When we started this project, we began with some discovery sessions where we all shared our respective workflows. So mind you, this is a panel of subject matter experts of various nurses and also pharmacists. We often found common ground, but we also discovered new ideas and different touch points and key junctures along that OAM journey. For example, the pharmacists were able to share their insights into their unique workflows within their practice setting. What resulted is really a resource that truly reflects that collaborative effort between the disciplines.
You're listening to the ONS Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Hello, and welcome to the ONS Podcast. I'm your host, Jamie Weimer, Manager of Oncology Nursing Practice at ONS. And today we're talking with Mary Anderson, Senior Manager of Nursing Membership and Professional Development at the Network for Collaborative Oncology Development and Advancement, or NCODA, and Chris Lefebvre, Oncology Clinical Specialist here at ONS, about the Oral Anticancer Medication Care Compass, Resources for Interprofessional Navigation, a project created as a collaboration between ONS and NCODA. This episode is not eligible for NCPD contact hours. Welcome to you both, and thanks for joining us today, Mary and Chris.
Thanks for having us.
Hi, Jamie. Hi, Chris.
Thank you both for joining us. I'm excited to talk about this great resource that we've created with our two organizations collaborating together. So, Chris, to start off, can you explain what the OAM Care Compass is and what gap in patient care it was designed to fill? What makes this a unique resource for our oncology care teams?
So the OAM Care Compass is a collection of different resources. They've been developed by an interprofessional team in order to support practitioners who care for people taking OAM medications. We know that the literature really supports the use of an established OAM program in order to improve adherence with OAM medications. And this includes processes for patient education and counseling, drug procurement and delivery, and proactive monitoring and follow-up with the patients. The team set out to develop resources that they could use to support patients taking OAMs regardless of the setting.
Thanks for that, Chris. So, Mary, in your practice, what challenges did you face or did you come upon in caring for patients that were taking these oral anti-cancer medications, or OAMs, as we're calling them for short? What did you experience that helped lead ONS and NCODA to kind of work together to create this valuable resource?
So I guess when I think about creating this resource, I really like to build on my experience from 15 years ago when I was caring for patients taking OAM. And I really lacked the confidence in educating my patients on a specific medication or even helping them obtain their medication. So 15 years ago, we're thinking 2010, right? And so this is before we had EHRs and e-prescribing. And really, there was no proactive plan for even tracking prescriptions for our patients. We had very little collaboration between the disciplines. We didn't have any defined roles. And once again, this is before we had that e-prescribing. And I was literally handing my patients handwritten prescriptions and telling them to take that prescription to their pharmacy and call me when they heard something. So also along those lines, we really didn't have a process for proactively outreach calls for our patients either. And so ultimately what was happening was we were placing a very heavy burden on our patients to not only obtain their medications, but also to stay on track with the medications. It was those challenges that I experienced early on and that lack of confidence that really led me to this passion and to create this resource with ONS.
Absolutely, Mary. I remember those days as well. I think the oral anti-cancer medications kind of slowly snuck up on us a little bit. Like at first, maybe they were so infrequent that we just sort of found a way to incorporate them into sort of the normal routine in clinic. And then suddenly, like, way too many to manage, specialty pharmacies, every different pharmacy for every different payer. Like it just kind of exploded. And we quickly recognized that like we don't have the infrastructure and the support we need, like you said, for patients ultimately, but also for our nurses to help them kind of understand what do they need to do? What do they need to keep track of? This is a great resource for nurses and ultimately to help support patients. So I'm excited to talk more about that. Chris, talk to me a little bit about why your experience in this partnership between our organizations, NCODA and ONS, why was it so important for this project, do you think?
Well, when you think about it in practice, there's nothing more important than the care team working together collaboratively in order to support the needs of the patient. By building tools and resources collaboratively, it's only going to be a help. ONS brings a lot of experienced nurses to the table. That we have nurses who are working in navigation, nurses who work as oral therapy navigators, who work as APNs, and so forth. But in CODA, in addition to nurses within their membership, they also have a great number of pharmacists. And bringing those voices together really helped the project along and to identify what gaps there were out there in resources and to help build some new ones.
I love that. And you're so right, Chris, that this work does not happen really in a silo. It's not all nurses, it's not all pharmacy. It has to be a blend of both of our professions together, working and sharing our knowledge, sharing our expertise, and ultimately creating this great resource that will benefit our patients. And so, Mary, how did you see that interprofessional collaboration ultimately strengthen that final resource that we created?
So when we started this project, we began with some discovery sessions where we all shared our respective workflows. So mind you, this is a panel of subject matter experts of various nurses and also pharmacists. And what we found was we often found common ground, but we also discovered new ideas and different touch points and key junctures along that OAM journey that we really hadn't previously identified. For example, the pharmacists were able to share their insights into their unique workflows within their practice setting and treatment planning and working with the providers and patient counseling and also dispensing procedures. What resulted is really a resource that truly reflects that collaborative effort between the disciplines.
Now, we will, of course, include a link to the OAM Care Compass on the episode notes of this show. But Chris, would you mind to just kind of talk us through a little bit? What are the specific tools and resources that are included in the OAM Care Compass? And how can oncology professionals use them in their daily practice?
There are 5 different elements to the Care Compass itself. And then there's also some supportive information that you can find on the website. The first of the 5 tools is called the OAM Workflow Analysis Tool. To kind of build upon what Mary was just saying, how everyone found different places within their workflow, during that process of discovery, we found places where patients can fall through the cracks. What this workflow analysis tool does is it allows an OAM program to really study where their processes are, where are the gaps in their process, and where might their patients be at risk. It's something that you can use within your setting to analyze your current processes and see where you can strengthen them. The second tool is something focused on patient and caregiver education. This includes a lot of information about what should be taught, how it could be taught, the best timing, and so forth, according to the literature. But it also includes an educational checklist. That checklist could potentially go into your electronic health record and be able to support your documentation as you're doing education on an OAM with the patient and their family. The third tool is an assessment and grading tool. It's kind of a fun tool that approaches symptom management using the CTCAE grading tool, the Common Terminology Criteria for Adverse Events. It's a national grading tool, and it allows healthcare providers to speak the same language when it comes to side effects. It allows the patient to be assessed for how bad the symptom is and to be able to convey that severity to the healthcare team in, again, that common language. The fourth tool is a specialty pharmacy and patient assistance contact directory template. I know it's a big mouthful, but basically, this is a spreadsheet that can be used by anyone navigating patient care with OAMs to keep track of their professional contacts. So if you have a certain person that you work with consistently over at a specialty pharmacy, copy down their email, their phone number, however you best contact them, and maybe some information about, well, when we put an order in at this location. They like to have this information as well. So it's something to just help facilitate that navigation of the patient between the different sites. And then the final one is the OAM adherence blueprint. And this has a lot of important information on adherence, methods to assess adherence, calculate adherence rate, and different tools that were found in the literature, both for research and in clinical practice, to assess adherence and the barriers to adherence that caregivers are encountering. We also have some supportive information, as I mentioned. We did a webinar jointly talking about OAM care and ways that we can all work together to address the needs of the patient, and then also other links to other resources that are out there.
I love that. All of those tools sound just so unique, but so necessary. And it acknowledges that every place can't do it the same. That, despite that would be maybe the ideal state for some of us who like consistency and control. I mean, every location is different. The resources available, the personnel that are available to help guide this work, those are always going to be different. And so I really appreciate how it sounds like each of these tools gives some of those tips of how things could be structured or standardized, but also acknowledges that every location is different and the needs of each program might be a little bit different. So it sounds like a great wealth of information to consider, regardless of kind of the stage that your oral anti-cancer medication program might be in. It sounds like there's something there for everybody.
There really is. And the thing that I liked is during the development, as Mary mentioned earlier, we went through that long period of discovery where we really learned from one another. The volunteers all had different settings that they worked in. So what worked in a rural setting may not be the same that would work in a large academic center. And if a oral navigation nurse is working on their own for a large health system, it can be very, very different than a pharmacy process working in a small community hospital. So it really brought a lot of things to light, and we tried to adapt to that with the many tools that were developed.
So, Mary, what do you think was maybe one of the most interesting things that you learned during the development of the OAM Care Compass?
Building on what you all were just talking about, I think really is how many touch points and key junctures we actually identified that are occurring along that OAM journey, regardless of the practice setting. When we decided to develop this workflow analysis tool, I hosted an activity with a working group, and I had them list all of the touch points, every key juncture that was addressed in their practice, whether they were doing it or somebody else was doing it. I said, just give me a list. And so when I compiled that list into a spreadsheet, we had over 200 touch points. And these are all potential areas where we could lose track of our patients and they can fall through the cracks. We had many touch points in common, but some are also fairly clinic specific. So we sort of weeded out those ones that were like really clinic specific and tried to use those high level touch points in developing that workflow analysis tool. But what we found out in the end is that we're all approaching those key junctures and touch points based on the resources that we have and the staff that we have available. Like you all already said, there is no one way to do it. It's just a matter of making sure that all of those touch points are being addressed and followed and that roles are identified.
Chris, in managing patients who are on OAMs, we know it requires a sort of a team effort. Why do you think interprofessional collaboration is so vital in this area? And what do you see as maybe the specific roles that oncology nurses need to be contributing to this team to ensure that we're providing safe and effective care for our patients?
We touched on the interprofessional collaboration. It is so essential just in day-to-day care. And OAM care is no different in that regard. The oncology nurses work in so many different settings, and their role may be so very different, even if they have the same title. You can have OAM navigation that is completely handled in the pharmacy. I've talked with nurses who said, we don't even touch it. But they do, because when a patient has a combination regimen, they might have an infusion regimen that goes along with an oral therapy, or that patient might just know that infusion room nurse so much better, and they feel more comfortable when they have a side effect from their oral therapy, they're going to call the infusion nurse that they know. So infusion nurses need to be aware of what the patients are on and what the potential side effects and so forth are. In addition to that, you may have somebody who's working as a navigator, but they're working as an oral therapies navigator for multiple institutions. I've talked with nurse navigators who work for a large health system and they have 10 different sites and they need to manage the care of patients regardless of the site that they're at, where one site might do their education a little bit differently than the other site. So you really have a lot of variety there. You can also have the pharmacy caring for the patients independently of the nurses. And when that happens, it's not so much with the nurses, but maybe the pharmacist can do education with the infusion nurses and stay in communication that way. So there's really a lot of different approaches to OAM care, and nurses, regardless of their setting, even if they're inpatient, outpatient, and so forth, it will impact the care that they're providing to their patients.
Absolutely. Very well stated. Mary, how do you think tools like the OAM Care Compass can help nurses in boosting their confidence in managing patients on OAMs?
One of the first things I think about is the resource for OAM education that we created. It is literally a blueprint of many resources out there to help nurses and pharmacists and oncology professionals educate their patients on taking OAM. I sure wish I had that resource 15 years ago, along with the pharmacist collaboration that we have today. That's number one. And I also really like how the OAM Care Compass helps create those processes and identifies those roles for everyone involved. And not only identifying roles, but also helping with communication channels, right? And help knowing that all the documentation is occurring and when everybody is documenting within their role and according to those key touch points, there's less opportunity to lose track of your patients because we know it's happening. So also when nurses do have a specific concern, they now have resources out there, be it resources with online, but also within their practice. So whether it's a pharmacist for drug-related questions or the provider for dose adjustments or AE or toxicity questions, or even if there is an oral oncolytic nurse navigator in the practice to assist with patient education or helping the patient acquire their medication. Now we're seeing that these processes are being developed where nurses who are boots on the ground caring for patients, like Chris said, in these combination regimens, at least they have a resource and somebody that they can go to help them, that they are not alone in this. So all nurses now really should have a better understanding of how they play an important role in coordinating the care to keep our patients from falling through the cracks.
Absolutely. So important. And as you both have mentioned now, whether we realize it or not, whether maybe it's not the biggest part of our job, but all oncology nurses play a part in patients making sure that they are safely receiving their oral therapies. And so thank you both for coming on the podcast today to share just the great work that our two organizations have come together to create this wonderful toolkit. And certainly I hope that listeners will take an opportunity to look at all of the wonderful tools that you've helped describe today and just ask how they can fit those into their practice or how can they use some of those tools to help improve the practice that they currently have in helping to manage these OAMs for their patients. As we reach the end of our episode, we like to always kind of run through just a series of some quick questions to help summarize some of the great things we've discussed today. And so to start that off, Chris, how do you think healthcare professionals should evaluate their hidden or implicit bias that they might hold about oral anti-cancer medications?
I think initially when oral therapies came out, many providers thought they were less effective or better tolerated than infusional therapies, but that's really not the case. As we're learning, as more and more drugs are approved and put into use, we're seeing that a lot more. Regardless of the route of treatment, healthcare providers really need to assess how the patients are tolerating their treatment. So we need to see how they're doing with their symptom management and also to look at what type of supportive medications do they have access to. Is this a patient that is able to obtain their supportive medications? Do they have a pharmacy in their area? Do they have access to transportation to get their blood drawn when that's due, or to have a follow-up test? Are there financial concerns that need to be assessed outside of the price of the medication? So all of these things, we tend to think, oh, we know it's important that they're receiving their cancer care, but they might not realize the importance of adherence, of receiving that care and taking those medications as prescribed. And it's up to us as healthcare providers to really reinforce that, make sure that those barriers are minimized.
Mary, what are some of the common misconceptions you see about oral anti-cancer medications?
So, Jamie, I think the biggest misconception that we see is that people think that taking oral anti-cancer medications is easier than infusion therapies. While it's true that OAMs do offer significant benefits, such as, the convenience and the ability for patients to take their medication at home, we are also placing a huge burden on our patients where they need to navigate that very complex health system to obtain their medication and understand their treatment plan and adhere to that precise regimen. And additionally, we are seeing more and more complex treatment regimens with combination therapies, right? Which further increases the need for that early and ongoing education and monitoring and support. And I also would like to reiterate what Chris talked about also is identifying those barriers to adherence before the patient begins therapy. That is really important. And that's something that I think is really, we're seeing a bigger awareness of today is how can we address those barriers before the patient begins their therapy instead of waiting for the shoe to drop.
Chris, what's something about this topic that's not often discussed, but you wish people knew more about?
One of the biggest things are the hidden costs. We talk about that a lot in oncology in general, but the hidden costs of having follow-up supportive medicines, of testing, and so forth, all of that is very difficult to manage. And as Mary just mentioned, some of the regimens are very complicated. And with that, it involves even more to kind of keep track of how you're taking your medication, when you're taking your medication, can it be taken with food, and so forth. And it ends up having an impact on someone's quality of life that we don't always think about.
Mary, what additional training or education do you think oncology nurses need to stay current on this topic?
I think with the ever-changing oncology landscape is staying on top of all the latest and greatest treatment regimens that are out there, that can be extremely overwhelming, especially with the different modalities of treatment that we have. But fortunately, with ONS and NCODA and other resources, we are able to stay on top of all these. It does take time, and it's probably time that you might have to do during off work hours. But also, in addition to the resources that NCODA and ONS provides, I'd like to encourage nurses to sign up for email notifications from the FDA, new approvals, and NCCN. Those are great ways just to get quick bullet points on what is happening out there, on studies that are happening, or what drugs have been approved. And also joining email lists for patient advocacy organizations. A lot of these organizations do provide a lot of complementary continuing education as well as ONS and NCODA.
I love that. And I would also chime in that while I know the state of my own inbox and how many emails I get, my latest trick has been to try to use my social media presence for my own professional good. So, liking those organizations on their various platforms. I mean, they also are sharing information. I know we all probably spend more time than we should on those platforms anyways. And so, as you said, sometimes it can't all happen inside work hours, but if that's a place that you're already consuming information, why not add a little bit of clinical information to those as well? So another idea of ways to just stay current and stay aware of what's coming out or what's new. Those are some great recommendations, Mary. And Chris, what do you think are some additional resources that we could share with our patients or maybe even other healthcare professionals who want to learn more about oral anti-cancer medications?
The organizations that Mary just mentioned often have information for patients as well, direct education. The oral chemotherapy education sheets are being transitioned over to something called the patient education sheets, and they're expanding the scope of them and so forth. And a lot of people use those for patient education directly. There's also some good information on the ONS Learning Library, ONS guidelines. Those are directed for nurses, definitely, but to draw on those resources in teaching your patients will be helpful. HOPA, the Hematology Oncology Pharmacy Association, has some great resources on oral therapies. And certainly the Encota nursing community has some wonderful resources as well. So they are more directed toward the nurses themselves, but you can certainly adapt those needs to meet the needs of your patient.
I would also add that sometimes the best resource for either for nurses or the patients that we are serving is sometimes it's other nurses can be a resource. So talking to other nurses who are challenged by the same things you are or experiencing some of the things that you're trying to work through. And so for ONS members, we have our ONS communities. There is a dedicated community for oral adherence and anti-cancer medication management. And so any of those forums where you can connect with your peers and just share your struggles and sort of crowdsource some ideas and inspiration can always be a great start when you're trying to troubleshoot a certain problem. So something to keep in mind as well. Well, Mary and Chris, thank you again for joining me on the podcast today and sharing all of the great work that you both did on behalf of our organizations to create this wonderful OAM Care Compass. And I sure hope that our listeners will, if they haven't already, will use this as a chance to explore it, share it with their colleagues, and just figure out the best way that they can implement some of these tools into their everyday practice. Do either of you have any final comments to share? Mary, I'll start with you.
So first of all, thank you, Jamie, and thank you, Chris. But it's been a great working with ONS, and I always appreciate the collaboration that ONS and Encota have together in bringing together this wonderful group of volunteers and oncology care professionals and creating this amazing resource that really does ultimately have a profound impact on our patients. So thank you very much.
And I need to echo what Mary said. The volunteers that worked on this project, it was over a long period of time, and they really gave of themselves, their time, their energy, their expertise. And so heartfelt thanks to everybody there, as well as to Mary, Encota, the Encota staff, and ONS staff that all contributed. It takes a village, truly, and it was a wonderful collaboration.
Well, thank you both again for joining, and I encourage all of our listeners to take a chance to review the OAM Care Compass. Thank you for listening to the ONS Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org and ons.org/voice. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.